Mark. I'm Jenny Garcia. I am a registered dental hygienist with the Coconino County Department of Public Health Services. And what I'd like to do for you today is do what we call an oral cancer check. Okay. You know, because you have in the past chewed tobacco, right. And so sometimes in the oral cavity we can actually pick up lesions, and so early intervention is going to be better.
I'm 47 now. I quit when my daughter was 4. She's 22 now, so almost 18 years ago I quit. 17, 18 years ago. This is my nose ring. This is one of my earrings. So
earring, nose ring.
Yeah, you can tell it's me.
He's had a few root canals, a few crowns. The level of his bone looks really good. And one of the factors that we consider when we're looking at someone who has chewed tobacco is the bone level. So if you look at this patient's bone level, you can see the bone is right where it needs to be. So the fortunate thing with him is he probably quit early enough where he didn't end up having loss of bone.
Let's do a little check on you. Let's do a cancer check.
Sure, of course.
Because I've got that bony protrusion thing.
Okay.
I know there's a bump in the bottom of my
Okay. And you'll have lymph nodes. Like I feel this right here, but they're lymph nodes, and they're bilateral. If there was a big bump on this side and not on this side, then we'd be like,
I think that's what happened to Kurt Schilling. He found a lump on one side.
Now, so here's where you probably had the chew, okay? And so you ended up with a recession on this canine tooth. If you go a little bit more forward, let me blow a little bit of air so that you can see. You can see that you lost a little bit of attachment here and here. Yeah. This one's probably about this one's about 2 millimeters.
So that's one of the things with people who dip a lot of times. You'll keep it in one area, that's your preferred area, and then it'll get raw, it'll get sore, so you have to move it. You know, when I was actually decided to quit, I was actually packing my chew up here because I was bleeding out of my gums.
Yeah. But actually, since you've made the right choice to stop chewing tobacco, things actually do look good in there. I don't see any signs of precancer cells or leukopelakia or Dipper's pouch.
Okay, good.
Looks good.
Good.
If you look at these teeth here, this is a good example of somebody who's actually had gum disease. You can see the recession areas where the gum has receded, and this is probably about 6 millimeters of root showing. You can also compare from the top x-ray to the bottom x-ray how this person has actually lost bone. Bone will not grow back like your hair or your nails do. So once you've lost bone, you've lost bone. These teeth now become mobile. So when we're checking for someone who has chewed tobacco, we're checking for stages of periodontal disease, which is a form of gum disease. We're looking at the gum, we're looking at the bone, we're looking at the recession, and we're measuring the pocket depth. And then here's black hairy tongue. So I always tell all my patients to brush your tongue. And the reason being is people can't really tell that the tongue has these little hairs. And what happens is the tobacco and all the cancer-causing agents get trapped in there. So this is what we call black hairy tongue. And here is an ulcer that probably started inside the lower lip and then ended up becoming where it actually affected the exterior part.
So is that cancer?
Yes, it is cancer. So this gentleman actually ended up having surgery and was left without half of his jaw. So it's important for us to educate the young population because they think chewing is safer than smoking, but in essence it's not, because then you end up with having, like I said, mouth cancer, periodontal disease, esophagus, stomach, pancreatic cancer. It's preventable if you don't chew, if you don't smoke.